One. Hello, I would like to welcome you to A Healthier You. I'm Larry Macon Jr., pastor at Mount Zion Oakwood Village, and I'm also the co-host of the show It's About You on WKYC Channel 3, where weekly I recognize people in the community who are doing great things. However, this series is about you. Yes, it's about your health and about you being healthy even during a pandemic. You know, as a leader in the community, I felt compelled to make sure that we gave you the latest information when it comes to your health. And so I'm so pleased to be partnering with university hospitals on this project to spread the word in the community about how you can live a healthier life. Today, I'm speaking with Dr. Alejandro Rivas, who is here with us today. Dr. Rivas, what are we talking about today? Tell us a little bit about yourself.
So thank you very much for the invitation. And today we're talking about hearing loss. I think hearing loss is one of the more predominant diseases in the world and in the country. It takes a toll into our community, our ability to communicate with people, and our ability to understand other people. And so hearing loss can happen from very early on as a cause of genetic hearing losses, from mild to complete deafness. But those who who were born with typical normal hearing, over time, that hearing loss can start to decline over time, and that impacts our communication and can impact our interactions with people. It can impact our social activity, and can impact the cognition and ability and has been shown to have an impact on dementia as well.
Oh, wow. Wow. So it's a lot that goes into that, Dr. Rivas. And of course, you're an ENT, an ear, nose, and throat doctor. So of course, the hearing problems go right into your realm and scope of work. So if you can let us know, how does hearing loss affect your communication?
Yeah. So obviously, communication has three different aspects. One is the ability to hear. The other one is your ability to speak. And ultimately is the ability to get both of those together at the level of the brain. And so your brain is your computer, is what puts everything together. And you can have different levels of impairs during that process. A patient that cannot hear, they cannot talk. Nowadays, when we are using masks, for example, this one, is very difficult for people to actually start understanding what they were not used to. A lot of people take advantage of visual cues to be able to understand when they don't hear well. And now that we're using masks, that visual cues of lip reading kind of is taken away. And so that's actually part of the reason why I use those masks that have a little window in it for my patients, so that actually they can see my lips and then they can understand what I'm saying. But it impacts our community in a tremendous way. And you can see that by the amount of hearing loss that is occurring over time is tremendous. And we're seeing it at a much younger age now that it used to be 30 or 40 years ago. Part of it is noise exposure. Part of it is the fact that our children and teenagers are using headphones all the time, many times very loudly, and that over time, noise-induced hearing loss is a current problem over time.
Wow, that makes a lot of sense. But I also hear that hearing loss can also affect your cognition and dementia. Tell us about those relationships there.
Yeah, absolutely. So what happens is that part of our cognition is dependent on social interaction.
Mhm.
Okay, it is very important to keep our brains useful. When people don't have hearing, they isolate themselves,
Mhm.
either because they might not have ability to get hearing aids, They might not be able to, or might not want to, don't like hearing aids. For many years, there has been a negative connotation of having hearing aids. And so, unfortunately, the problem with that is that as that hearing loss progresses and it becomes worse and worse and worse, people start getting embarrassed of always having to ask, excuse me, what did you say? And they start to seclude themselves and stop being interactive with other people. And that on its own isolation can be a predominant factor of dementia and Alzheimer's.
Oh, wow. That's amazing. And also we're finding out that, of course, hearing loss can affect you over time. How does that natural progression go? I know you spoke about noise and how it can cause an issue, but how does that natural progression happen as you get older?
Well, there's something called age-related hearing loss and noise induced hearing loss. They're separate, but in a way the same, because unfortunately we live in a noisy world. Okay, we don't live in a bubble. We live in the outside world where there's noisy environments, and over time, our hearing starts to decline. And that's without having any sort of necessarily pathology. That's a normal age-related cause. Now, when you add, if you have your dad or your grandparents who have hearing loss, typically you're prone to develop hearing loss over time. And we know that the normal progression is that you typically start having a little bit of hearing loss a little bit earlier than the generation before you. So if your grandparents started to have them at their 70s, and then your parents started having at their 60s, now we know that it's crucial, for example, to start getting hearing tests and evaluating your hearing as early, if you think that you have normal hearing, to do it as early as your 40s or 50s, particularly when your spouse or your partner or your family starts to say, you need to check your hearing. You're not hearing me. And I joke with my patients all the time saying, yeah, that can be selective hearing loss, but more frequent than not is actually there is some degree of hearing loss in the high frequencies.
Wow. So you got to know when it's time and when you notice something happening. But there's a lot of management tools out there if you're having hearing problems. So what do we do when we have hearing problems?
Well, it depends what the cause of the hearing loss is. And in general, we have two types of hearing losses. There's one thing that is called a conductive hearing loss and something that is called a nerve hearing loss. Conductive hearing loss means that, for example, if you plug your ear, the conduction is not getting through that clogged ear. Or if you get water in the ear, the conduction is not getting through that clogged ear. And for that, there are typically procedures that we do to improve that. That either needs a little procedure or surgery to improve those. Your ear has little bones that amplify sound. Sometimes those bones stop working, and we can fix them to improve that hearing. And typically that requires surgery. The other type of the nerve hearing loss, which is what it's becoming more and more frequent in our communities, is typically addressed at the beginning with hearing aids. And nowadays, there's many types of hearing aids. Typically, they're very small, very inconspicuous, and you put a little tiny clear cable that goes into the ear, and it's rare. I rarely see them on my patients, to be very honest. When I actually see them, is very inconspicuous, and that it's enough to improve their hearing and improve their communication. Now, if their hearing progresses to the point that a hearing aid is not useful anymore, then we're coming into the realm of cochlear implants.
Okay.
And what a cochlear implant is a beautiful prosthesis. Is the one prosthesis that can restore a sense. No, there's no other device that can do that. And so we can actually restore hearing on patients with a cochlear implant. Is not the same as your natural hearing because this is an electronic device. And so as you would imagine, you're going to hear electronically. But over time, your brain adapts to that because our brains are very malleable.
Wow.
And therefore, it's a great device for people where hearing aids are not longer an option.
Gotcha. Well, Dr. Rivas, I appreciate all this knowledge on hearing, and it's good to know now that technology allows us to actually restore that sense. And I didn't know that was one of the only senses that you can probably get, corrected right now when it comes to technology. So I appreciate ENTs like yourself who are able to make people's life a lot easier, help them communicate when they are having some real challenges. So to all of our viewers, make sure that you head to university hospitals, see Dr. Rivas if you're having some ear, nose or throat problems, but especially when it comes to your hearing, make sure that you reach out to him, and also continue to watch me as I continue to speak with doctors about challenges that you're having. This is great information for the community. And again, thank you. And remember that good health is good wealth. Thanks again, Dr. Rivas, for being on this segment.
Thank you so much for the invitation. It's great to be here with you guys.